a silent and deadly threat is emerging in Japan. Cases of flesh-eating bacteria infections are on the rise, causing alarm among health officials and the public. This aggressive bacteria, known scientifically as necrotizing fasciitis, can destroy skin, muscle, and tissue at an alarming rate. The recent surge in cases is particularly concerning. While not as contagious as some other infections, flesh-eating bacteria pose a serious health threat. Early diagnosis and treatment are crucial for survival, making awareness and understanding of this deadly infection paramount. This essay aims to shed light on this growing health concern. We will explore how the bacteria spread, the symptoms to watch out for, and most importantly, the steps you can take to protect yourself and your loved ones. Knowledge is power, and in this case, it could be the key to saving lives. Flesh-eating bacteria typically enter the body through a break in the skin. This could be a cut, scrape, burn, insect bite, or even a surgical wound. Once inside, the bacteria multiply rapidly, releasing toxins that damage and destroy surrounding tissues. Certain environments and activities can increase your risk of infection. These include swimming in warm, brackish water, particularly if you have open wounds. Exposure to shellfish, especially raw or undercooked, also poses a risk. People with weakened immune systems are particularly vulnerable to severe infection. This includes individuals with diabetes, cancer, liver disease, or HIV/AIDS. It is crucial for these individuals to be extra cautious and seek immediate medical attention if they suspect any signs of infection. Early symptoms of a flesh-eating bacteria infection can often be mistaken for less serious conditions. The affected area may be red, swollen, and painful, resembling a spider bite or a pulled muscle. Flu-like symptoms, such as fever, chills, and nausea, are also common in the initial stages. As the infection progresses, the pain intensifies, often becoming unbearable. The skin may blister and turn a dark purplish color as tissues begin to die. In later stages, confusion, lethargy, and even organ failure can occur. It is crucial to emphasize that flesh-eating bacteria infections can progress rapidly. What might start as a minor discomfort can quickly escalate into a life-threatening situation within hours. Section 4. Time is muscle. The importance of early detection and treatment. Early detection and treatment are absolutely critical when it comes to flesh-eating bacteria infections. The sooner medical intervention begins, the better the chances of survival and minimizing long-term damage. Treatment typically involves a multifaceted approach. Powerful intravenous antibiotics are administered to kill the bacteria, while surgical debridement is often necessary to remove dead and infected tissue. In severe cases, amputation may be required to stop the spread of infection. Any delay in seeking medical attention can have devastating consequences. If you suspect you may have a flesh-eating bacteria infection, do not hesitate to seek immediate medical care. Remember, time is of the essence when it comes to this deadly infection. Section 5. Protecting yourself. Practical tips for prevention. While the thought of flesh-eating bacteria can be frightening, there are practical steps you can take to protect yourself and your loved ones. Good hygiene is paramount. Wash your hands frequently with soap and water, especially after handling raw meat or seafood. If you have any cuts or wounds, clean them thoroughly and keep them covered with a clean bandage until they are fully healed. Avoid swimming in warm brackish water, particularly if you have open sores. If you do swim in these waters, be sure to shower thoroughly afterward. Be cautious when handling shellfish, especially if you have any cuts on your hands. Cook seafood thoroughly before eating. If you have any underlying health conditions that weaken your immune system, take extra precautions and seek medical attention promptly if you notice any signs of infection. Section 6. Staying informed, staying safe, resources, and future outlook. The recent surge in flesh-eating bacteria cases in Japan is a stark reminder of the ever-present threat of infectious diseases. Staying informed about these threats and taking appropriate preventative measures is crucial for protecting public health. Health authorities in Japan are actively monitoring the situation and working to raise awareness about flesh-eating bacteria. They are providing information to the public on how to identify symptoms, prevent infection, and seek timely medical treatment. By staying informed, taking preventative measures, and seeking prompt medical attention when necessary, we can work together to combat this emerging health threat. Remember, knowledge is power, and in the face of infectious diseases, it can also be a lifesaver.